Okay. Hello, everybody. My name is Krysia Sadzikowska, and I'm part of Trinity College AMR Action Group. I'm very happy to have Pravarsha Prakash here with us today. Before we begin, just a couple words about her. So Pravarsha is currently working for the World Health Organization as Technical Officer for Monitoring and Evaluation in the Antimicrobial Resistance Division. She supported the development of the Global Action Plan on AMR and has since supported WHO's efforts in coordinating AMR-related work across the organization. With strong interests in One Health aspects of AMR, she's involved in the development and current rollout of the Tripartite Monitoring and Evaluation framework on AMR. She also manages the multi-sectoral country AMR Self-Assessment Survey administered by WHO along with the Food and Agriculture Organization of the United Nations and World Organization for Animal Health. So without further ado, let's welcome Pravarsha.
Thank you very much for having me. I'm excited to be here, and I'm happy to present on a little bit of our findings from the Tripartite AMR Country Self-Assessment, or TrACSS as we call it, that basically is looking at how we can monitor the global progress on implementation of the Global Action Plan on AMR. So I guess I'll get right into it. Thank you so much for having me again and for the introduction. So we know that AMR, of course, is an important public health issue, causing about 30,000 deaths per year in Europe and US, and it quite well be that worldwide as well. And we have a report from about 33 countries that shows that there is E. coli resistance to third generation cephalosporin and ciprofloxacin already, including in bloodstream infections and urinary tract infections as well. And studies have also found that approximately 30% of newborns with sepsis die due to bacterial infections resistant to first-line antibiotics. And of course, a big driver of this is a lot of inappropriate antibiotic prescriptions. Now, when we look at AMR itself, it's a complex issue that requires really a comprehensive multi-sectoral response. And the drivers and impact of AMR lies in humans, in terrestrial and aquatic animals, in the environment, in food, in plants, in feed. And all of these are really very closely interconnected. And when we look at what are the drivers of AMR, we can talk about misuse or an overuse of antimicrobials, lack of access to clean water, sanitation and hygiene, both in humans and for animals, poor infection and disease prevention and control in healthcare facilities and in farms, poor access to quality and affordable medicines, vaccines and diagnostics, and overall a general lack of awareness and knowledge, and most importantly also enforcement and legislation. And of course, now in the year of COVID-19, there well may be an increased risk that antibiotics are used wrongly, even more for viral infections. So this really calls for a One Health approach so that all the sectors are brought together to address this issue in a really cross-sectoral way. So what we did here in WHO, along with our tripartite partners, so our tripartite partners, of course, are the Food and Agricultural Organizations of the United Nations, or FAO, and the World Organization for Animal Health, OIE, is we adopted the Global Action Plan on AMR. And part of this Global Action Plan, when it was adopted, member states agreed to also have national action plans in line with the Global Action Plan to address AMR. So when we look at how we can monitor this implementation of country national action plans, the tripartite came together to then administer an annual AMR Country Self-Assessment Survey, or TrACSS, and we've administered this now since 2016, and 4 rounds have been completed with about 150 countries responding on an average over the last years. All the data is available online on our tripartite website, so amrcountryprogress.org, so you can look at how countries are responding to the survey. Everything is public. And we've also managed to publish 2 joint analysis reports. And we also regularly here in WHO use this data to report back to member states every year at our World Health Assembly. So I will basically be presenting data from the second joint analysis report, which is analyzing data from the 4th round of the TrACSS survey. So when we look at the structure of the TrACSS survey, it really is closely aligned with the objectives of the Global Action Plan. So the Global Action Plan has 5 objectives: awareness raising and education on AMR, the first; second, strengthening surveillance on AMR and antimicrobial use; reducing infections through strong infection prevention, control, and WASH; optimizing use of antimicrobials. And the last one is on research and development, but we don't ask any questions related to Objective 5 in TrACSS because the activities really are at a global level. So we look at these 4 objectives, the first 4 objectives, across the sectors of human health, plant health, animal health, food production, food safety, and the environment. And in addition, we also ask countries on progress of their National Action Plan development, how their multi-sector working groups function, and also whether or not they have legislations on antimicrobials. So when we look at the latest data, so this data has been published this year, we had 136 member states submitting data, and this is actually a 12% decrease in country responses compared to previous years, but we attribute this really to the COVID-19 pandemic challenges. And the TrACSS questionnaire, the indicators are assessed on a scale of A to E, with C serving really as a threshold for nationwide implementation for most indicators. And in this report, we also could do a trend analysis of about 115 countries who have consistently submitted data for the past 3 years to TrACSS. Now to actually come into the nitty-gritty of the data. So we found that of the 136 reporting countries, 120 have a national action plan. So there's been an increase over the years in number of countries that have a national action plan. But actually this number is much higher in reality. We know through other sources, through our regional offices, for example, that the number of countries with national action plans is actually 145 almost. So this is good. The trend is going in the right direction. The other indicator on multi-sector working group is really important for us because we found previous statistical analysis that having a country having a functional multi-sector group is really a very good predictor for achieving higher levels in other TrACSS indicators. So it's really important for countries to have a functional multi-sector group. And by that, we mean having a working group with very clear terms of reference, who can meet regularly, who has funding for the group itself and has defined activities and reporting mechanisms in place. So about 56% of countries have a functional multi-sector group, and we see a 21% increase over the last 3 years in number of countries having a functional multi-sector working group. And what's important also is we found that about 93% of these countries have good human and animal health representatives. When we come to country legislations on antimicrobials, over 90% of responding countries have regulations on prescription and sales of antimicrobials for human use. And of these 125 countries, 74 have a national level monitoring system for antimicrobial consumption in human health. So what this really means is about 51 of those remaining countries have the regulations on antimicrobials for human use in place, but their monitoring systems for antimicrobial consumption might not be sufficient to track the results of these regulations and policies so that their regulations or policies can be updated accordingly. Now, when we come look at animal health, about 77% of countries responded enacting regulations on prescription and sales for animal use, with 74 of those countries reporting consistent data collection on total quantity of antimicrobials sold for animal use at the national level. About 63% of countries reported having laws against the use of antimicrobials for growth promotion, and about 75% of countries also have regulations on marketing of pesticides, including antimicrobial pesticides used in plant production. Now, when we look at the actual objectives of the Global Action Plan, so the first one, raising awareness on AMR, about 45 countries have nationwide implementation of AMR awareness campaigns. And trend analysis also of this indicator over the years shows that there's been a gradual increase in percentage of countries with nationwide government-supported awareness campaigns. But it is really important to know that the sectors most involved in these awareness campaigns are mostly focused on human and animal health sectors. So definitely more needs to be done to include food safety, food production, environment, and plant health sectors, so that really they can be included in the messaging and outreach of these national AMR campaigns. When we look at the objective 2, so strengthening surveillance on AMR, but focusing on human health, we find about 75% of responding countries are at a level C or above, which indicates that countries have national AMR surveillance activities in place for some common bacterial pathogens and which are based on national standards. They have a national reference lab with good external quality assurance. Now, when we look at strengthening surveillance in the animal and food sectors, the distribution is quite similar. We have a similar percentage of countries collecting at least some AMR data in animal health and the food sectors. And systematic data collection is represented by levels D and E. So where data is systematically collected and reported on levels of resistance in at least one of the priority pathogen bacterial species identified for surveillance. And 42% of these countries report reaching this level in animal health compared to 40% in so basically, again, when we look at trend analysis here, we do definitely see gradual increases in national AMR surveillance activities, level C and above over the past 2 years. Now, when we look at surveillance of antimicrobial use and sale, there is actually an increase in animal health versus human health. And this could be due to trade incentives or animal health systems really maybe perhaps being established earlier than the human health systems. And for the most common response for animal health was at a level D, with about 42 countries reporting the data was collected and reported to OIE on a regular basis. And for human health, we see about 76 countries at level C to E, and about 32 of them report data that their data is collected on a regular basis at the country level for human use, and also maybe the antibiotic prescribing data is also collected in healthcare facilities. Now moving on to objective 4, which is objective 3, reducing infections through good infection prevention and control in human health. We see about 37 of the countries have nationwide implementation of IPC plans, and these are really in line with WHO's IPC guidelines. Our final objective is optimizing use of antimicrobials in human health, and about 72% of these countries respond to having practices to ensure that appropriate antimicrobial use, or at least that implementation is in some healthcare facilities. And only 6 countries have these antibiotic prescribing guidelines for major syndromes and actually send the antimicrobial use data back to the prescribers. The last indicator I will present on is the adoption of the AWARE classification. So AWARE is a new tool that WHO has released that classifies antibiotics into 3 stewardship groups: access, watch, and reserve, to really help countries improve antibiotic treatment, increase access, and reduce resistance. Countries can adopt AWARE into the National Essential Medicines list to guide antimicrobial stewardship activities. And we see a lot of evidence that shows that to optimize use of antibiotics and reduce resistance, countries should increase the proportion of access antibiotics to correspond to at least 60% of total national consumption. Now, this was the first year that we included this question into TrACSS, so we do not really have any trend data, but we found about 25% of the countries responded to having adopted AWARE classification into the National Action Plan, National Essential Medicines list, and more than half of the responding countries have knowledge of the AWARE classification and intend on incorporating it into the National Essential Medicines list in the near future. So just to summarize now the findings from the fourth round of TrACSS, there are a lot of areas that have shown consistent progress. For example, there's definitely been an increase in number of countries with national action plans, with functional multi-sector groups, and also an increase in number of countries with nationwide implementation of national infection prevention and control programs. And when you look at just the trend analysis, there's been increases in percentage of countries with nationwide awareness campaigns, and also an increase in both human and animal health in terms of national monitoring systems for antimicrobial consumption and use, and also for national surveillance systems for resistance. Now, when we look at areas that we really think need much more additional efforts that countries should focus on, is of course to strengthen multi-sector coordination and collaboration in not just in their implementation of national action plan, but also in terms of sharing information when it comes to responding to the survey. When we look at, there were some discrepancies when we did a little validation between TrACSS submissions and OIE's data on monitoring of antimicrobial sales in countries. Because when we validated it, we found that there might be some gaps in communication across and between sectors. So while there has been definitely an increase in number of countries with functional multi-sector groups responsible for NAP implementation, there needs to definitely be better communication and processes in place to increase collaboration across and within sectors. There also needs to be more done on awareness, because we see globally less than 50% of countries have nationwide government-funded AMR awareness campaigns. And most of these campaigns are really focused on the human and animal health sectors. So more needs to be done to bring in the other sectors of food safety, food production, environment, plant health, etc. Now, when we look at enforcement or monitoring of legislation, of course, 92% of countries reported having laws or regulations on prescription and sales of antimicrobials for human use, but only 54% of the countries have a national monitoring system for antimicrobial consumption. So really indicating that several countries have a gap in monitoring legislations involving antimicrobials. And also the presence of a legislation, we know, does not always indicate enforcement. So policies regarding prescription, dispensing, sales, and disposal of antimicrobials really needs to be strengthened, monitored, and enforced appropriately. There also needs to be done, more needs to be done on the access to essential antimicrobials and diagnostics. Really, we're trying to encourage countries to adopt the AWARE classification tool, and also to have better systems of diagnosis. And finally, strengthening data collection for AMR surveillance and antimicrobial consumption, as well as better data reporting and sharing across sectors, is needed to ensure that the development of national policies and strategies are informed by the country situation in a really effective way. So I'm going to stop here for now. Thank you very much for inviting me. If anyone has any questions, I'm happy to answer them.
Thank you so much, Pravarsha. This was really great talk. If anyone has any questions, just feel free to put them in the Q&A box, and then I can read them out. I can start us off with a question. So you talked a lot about what countries are doing to combat AMR and all the policies and regulations. But my question is what individuals can do to fight this problem of antimicrobial resistance?
I suppose that an individual, each individual is almost a mix of many things. Like, for example, if you are now studying medicine, your role is both as a citizen at some point, as the public, but also as a prescriber in the future. So I think education and awareness is the first step. So just be educated on what role you can do, which is take antibiotics responsibly, make sure you finish your course, and just be aware of that your actions have consequences as well. But I think even in terms of as a consumer, there's a lot of power you hold as well in terms of whether you're reaching out to food products with antibiotics used or not. So I think each of us have different roles in society to play, but most importantly is first just to be aware of what we can do, which is use antibiotics responsibly and make sure to demand as well your governments and policymakers to make the right choices as well.
Great, thank you so much. I don't think there are any more questions. Oh, there is one question. So Katerina is saying amazing talk, and she has a rather general question. How is the day-to-day routine of a WHO technical officer on the AMR division?
Well, I won't talk about my colleagues, but I can tell you what my day looks like. So I specifically work on monitoring. So I support countries develop monitoring systems, but WHO is now going towards really country level support and guidance to help so that they can build their own systems for monitoring the national action plans. So that's a little bit of my work, is to work with countries directly. A lot of it also is to manage this survey. So this is a global survey. So I send out the survey on behalf of FAO and OIE from here in WHO, and we then liaise with our regional and country offices to ensure that countries are responding to the survey, to ensure also that all the sectors are involved in responding to the survey as well. And a lot of work in WHO is, as probably in all other areas of work, are meetings, collaboration, coordination. So I think especially when you're working with other sectors, a lot of my work involves a lot of coordination, coordinating with countries, coordinating with the regional offices, but also coordinating with different units across WHO. So each unit is focusing on infection prevention. You have a different unit working on surveillance. So it's really working with all of them so we can see where we can get the data systems as well.
Great, thank you. I don't think there are any more questions. So thank you so much, Pravarsha, and thank you all for coming. Okay.
Yes, thank you. And just last note is that the analysis report is published on our website. So if you want to have a look at it or to play around with the data on the country progress website as well, that would be great. And any feedback you have or any questions, I'm happy to answer later as well.
Great. Thank you so much.
Thank you.
Bye.